I repair medical equipment, and we also do preventative maintenance, which means we check all the equipment at least once a year to make sure it's working like it should be. Anything that breaks down, they call us and we go get it, and then we repair that and put that back in service also. We want everything to work exactly like it's supposed to. We're equipment detectives.
Every single day, we get called with something that is not working properly, or somebody needs to be taught how to use it properly, or things like that. Every day is different. You never know.
Most simple would be a suction unit. Okay, that's the simplest piece of item that we have. The most complex is our MRI magnetic units and our CT units that scan you.
There's been times I've been in the elevator. Let's say something, a piece of equipment, I've had patients say like, "Oh, I like that. I've used that before in here. Or that's been hooked up to me before." But I think more of our feedback probably comes from the nurses and staff. If they're happy with it, they pretty much know that patient was comfortable and happy with it.
There's hardly any procedures done in the hospitals nowadays that don't have some piece of medical equipment attached to them for diagnosing and treatment. So it's a lot different than years ago. When you come into the hospital, you will get an IV put into you, and that piece of equipment is pumping that fluid in you. The doctor's depending on that equipment to work so they can quickly diagnose your problem and take care of you. If it doesn't function, it's not good that you're sitting there waiting for what is my diagnosis. It's not just a job. It's important that it works, and it works right the first time.
Everything went to computer. All the images are computer regenerated and put back together, and you get 3D slices, and a doctor in an office in New York could look at a X-ray here and help them diagnose. Technology has made things a lot better for the patient.
Our job is like a series of little victories all day long. And some days the problems are much larger than other days, but basically that's what we do. We solve problems.